Hello, Jeffers. How are you guys doing? Are you guys in here today with us? It's me and Kelly. Just gonna give you guys some time to check in. I know it's been a bit of a almost a bit of a heat wave in the Western Cape side of things, and I know like in the north of the country, it's a lot cooler. Hey, Pat, how you doing? What's up, Tanya?
Thanks for joining us.
Thank you guys for joining us. Where are you guys joining us from?
Let us know.
Do let us know. Hello, Tamsin. Hey, Dalian.
Hey. Let us know where you guys are. We were talking about the weather earlier.
Yeah,
Nice
where you guys? Oh, Durban.
Durbs. Lovely.
I'm sure the beaches there must be extremely warm. Hey, Renee. From George.
Just down the road from me.
Oh, good old Joburg. I see Katie's there from the UK. How's it going there with the winter? I know it's been, quite intense.
Katie's one of my clients. Thank you.
Oh, sure.
Thanks for joining, Katie.
Yes, guys, but it's Coach Tope and Coach Kelly here. I know our faces should be out a little bit more, but I think a little bit on the shy side, so we tend to need that bit of a kick to get pushed onto your screens. Don't worry, we're working on that, and we'll show up a little bit more going forward. But as you guys know, Coach Kelly is our resident physio. I don't know. I'm going to give her a little bit like the platform just for a bit to let us know how she got into the field.
Sure. I always wanted to be a physio actually growing up. Initially thought I would be like the Springbok rugby physio. That was kind of always the dream as a teenager. Then I did work shadow and realized that it was in hospital and it kind of crushed my dreams. So I ended up actually doing a BCom in my first year at varsity in economics and law. Realized that also wasn't right. So ended up defaulting back to physio. And absolutely loved it. Then specialized in sports physio, and then went on. I'm currently doing my master's. So you can say that I ended up really enjoying it. So I think I eventually did the right thing.
Most definitely. And I mean, Kelly does a crazy amount of work for us, with the rehab stuff. You guys need to go and, have a look at her Instagram. She has a lot of prehab, content there as well that will help you with a lot of, making sure you're preventing injuries and managing your recovery as well. But today, we're going to be talking
about... What about you? Tope is not getting off lightly here.
I was trying to run away from it.
No, exactly. So Tope is very sneaky. He just got his PhD in human physiology. Actually, when was that? About 3 weeks ago, Tope?
Yeah, at the start of February.
You're not getting away with that. So you can tell them about you now.
No, most definitely. I spent most of my varsity career at the University of Stellenbosch. Was definitely a lot into the concept of physiology and human physiology. The human body was just really fascinating to me. And I did my postgrad or my PhD in cardio-oncology because there were two aspects of it that just really, I related to a lot. I enjoyed the heart so much, and the concept of cancer was something that was huge for me because of obviously family members who had or struggled with that. So found myself with Jeff, just like Kelly has, and obviously we're going to take you through a topic that's been a bit of a hot one lately. I'm sure you guys have seen on the Jeff Together pages, there's been a post almost every day about foot pain. And so before I take you guys through it, I'm just going to ask a few questions, and then if you relate, you can say yes. If you don't, you don't have to say too much. You can just watch for the people that say yes. I don't know how many of you guys have, woken up in the morning, had a nice, lovely stretch, Got out of bed, put your feet on the floor, try to stand up, and then suddenly felt a really, really sharp pain at the bottom of your feet. If you've experienced that, please, just say I, say yes. If you haven't, that's fine. Or how many of you guys have been working the whole day on the desk and just, seated there in front of the computer for hours and hours, and then eventually you stand up and you feel a really sharp pain at the bottom of your feet? Oh, I see Pat. Pat says she's experienced that. And Sharon as well. And Stefan too. Yes, most definitely. Well, this is something that could be as a result of a condition known as plantar fasciitis. So now, here's the thing, and here's how the word is. It sounds like a really complicated word, but for a lot of scientific words, there's a reason why it's called jargon. You can break it down into very basic things. You have plantar, which pretty much means the bottom of your feet, and you have the fascia, which is the connective tissue at the bottom of your feet, and you have the itis, which means inflammation. And it's funny because Coach Kelly and I were talking about this, but it's so contradictory because it's not really an inflammatory condition, but it has the itis at the end of the word. So, interestingly, or just to try and bring into perspective why this happens, you want to try and think, and I see there that mine is talked about, wearing heels. So I'll bring that into it just in a little bit. But the way your feet walk, it really comes down to a lot of the stuff that we've learned, growing up in terms of our basic physics and our basic physiology. And what happens is it comes down to one of, Newton's laws that states that when you put or exert force at something, that thing that you're exerting force towards exerts an opposite and equal force towards you as well, or towards the thing that's exerting force. So I'll try to bring an example and just show you guys my hand over here. If I keep this hand static and I exert force towards it, I can feel the strain on both of my palms. And that's because despite the fact that I'm moving this palm towards this palm is also exerting force towards this palm. And so what happens is, on a daily basis, when you are walking around or running around and doing stuff like that, you are exerting force towards the floor. And I'm sure you guys have had theories about why, we're not built to wear shoes. It's more natural to not wear shoes and stuff like that. I always say we're also not really built to walk on concrete. So now let's put it like this, guys. Whilst you walking around, you're exerting an amount of force that is equivalent to, say, the activity that you're doing, the acceleration you're putting through your feet, and your body weight, which is your mass. So we know force is mass times acceleration. And so whenever you do that, for each step that you take, the floor is exerting an equal and opposite force right back into your feet. And I'll just like to ask that we have image one put up, if we can get it up, but I'll try and describe it. I can bring my feet up, but I'm sure if I do a few more flow sessions, I'll be able to for next time. But yes, so our feet, have been designed in ways to deal with this. And this is as a result of some of the muscles and connective tissue that we have at the bottom of our feet, or in the plantar region of our feet. So just taking you through a little bit of foot anatomy. We have our tibia and fibula that get connected to a huge bone known as the talus. This talus gets connected to the calcaneus, which is our heel bone. And that talus also connects to our phalanges and to our metatarsals and our phalanges, which are our toes. Now, between all of this, right at the bottom, I'm sure you guys can see it there where it says the plantar fascia. You have this connective tissue that connects the calcaneus, or your heel, to your phalanges and your metatarsals. Now, that connective tissue is known as the plantar fascia, as well as, the plantar muscles that are at the bottom of your feet. And together, they act as shock absorbers. They help to take in that force and dissipate the energy that's put right back into your feet from the floor. So I want you guys to think about it this way. Let's say you stood up and stamped into a mattress. You would notice that mattress will indent. And that's simply because you put in an amount of force into the mattress The mattress is returning that force into your feet. And what's happening now is because your foot's tensile strength is a lot stronger than the mattress has had to stretch. But the problem is you're not going to have that with the floor. And so when you say stamp on the floor remains the same. And so all of that energy is sent right back into your feet. And as such, your feet has to move to accommodate it. It has to kind of stretch a little bit. And that's what ends up stretching your plantar fascia. So there are a couple of, factors that make you more prone towards plantar fasciitis. And one of them is, say, having a very high arc. Now, if you have an high arc, I think we can bring in the image 2 as well. If you have a high arc, as you can see, the arc is pretty much made of your talus as well as your calcaneus, the muscles there at your the bones at your metatarsals and your phalanges, and then your plantar fascia pretty much stands at the bottom of it, just like this. All right. So now think about it this way: if you have a high arc, what's happening is you're likely to have a much shorter plantar fascia, and in its natural state, it's in a much shorter kind of like structure. And so every time you stamp into the floor, what happens is you stretch it out a lot. And that stretching leads to the development of micro tears that happen just around your heel section. And those micro tears lead to that pain that you feel when you have plantar fasciitis. On the converse side of things, if you have flat feet, you have an extra stretched plantar fascia, meaning that this fascia is already being strained. It's already being stretched out. And so when you are putting a lot of impact into the feet, your feet can stretch out much more to accommodate it. That leads to those micro tears that contribute towards plantar fasciitis. Other factors include wearing the wrong type of shoes. And how do your shoes play a role in here? Your shoes pretty much give you something that has a bit of a lower tensile strength than your feet. And so what happens here is when you stamp into the floor, your feet take the shape of that mattress that you would have stamped into in the first place. And I mean, your shoes take that shape. And so rather than your feet taking dissipating all of that energy, your shoes are able to dissipate the energy. And you need that to be efficient. And that's why you need to be wearing the right type of shoes. If you have very tight calves, your calves lead right into your Achilles tendon, which is one of the most powerful tendons in your body. That tendon will be pulling on your calcaneus or your sole, leading to an extra stretch on your plantar fascia, also making it prone towards plantar fasciitis. If you have a higher BMI or elevated weight as well, you have to think about it right down to the basics of it. As I mentioned earlier, force is mass times acceleration. So if you have more mass, you're producing more force. You're exerting more force into the floor is returning all of that force right back into your feet. And now your feet are having to take in all of that extra energy. And that could also, make you prone towards this. Now, listen, guys, I could go on and on and on and on for hours, but I don't want to. I'd just like to bring Kelly in here. She'll take us through some of the symptoms of it, take us through, the ways to diagnose plantar fasciitis and how to manage it. And then we can just, take you through some of the questions later. And I'll also deal with the heel question later on. Yes, Kelly, I think you can go.
I love watching how passionate you are about this. So it's awesome. No, I think you really explained it in a lovely way. So especially with the mattress and the floor, I like that. Okay, so just to point out, obviously, where we are now, not all, I was just reading Stefan's comment there about where his pain is. So just remember, although we're talking about this now, not all foot pain is going to be plantar fasciitis, okay? So it's quite common, that's why we picked the specific one. If you really are struggling, you need to go and have it checked out. Okay, so having said that, if someone were to walk into my physio practice, for example, complaining of foot pain, and I diagnose them with plantar fasciitis, there's certain tests that I would have done. Okay, so like Tope has said, talking about the fascia along the foot, one of the first sort of tests that I would do is you have the person standing flat and you can lift their big toe. So you're basically putting that fascia on a stretch, okay? That's one of the signs, okay? Then what you do as well is you combine that with the clinical symptoms, like Tope was saying earlier, first thing in the morning, or sitting for a long time and then getting up again, you get that sharpness underneath your foot. So you kind of pair those things together, okay? And then just while we're on that, I would usually use like a pain diary as well. So it does take quite a long time to get better, because if you think about it, we're up on our feet all the time, okay? Unless it's super severe and you need to go into a boot or use crutches or whatever it is. But generally, we will be on our feet all day, every day. So it's quite difficult to rest. So having said that, the pain diary would come in, and not everyone uses it. It's just a tool that I like to use and that you could do yourselves. Is first thing in the morning, how severe is my pain when I get out of bed, okay? In a week's time, is it that severe still? Is it taking the same amount of time to feel a little bit better, okay? So sometimes people think, oh, it's not getting any better. But if you have a pain diary and you look back and you say, actually, last week, my pain was a 9 out of 10 getting out of bed, and it stayed like that for half an hour. Today I'm getting out of bed, my pain's about a 6, and it's taking 10 minutes, okay? And that's a nice way to track it, to see whether it's getting any better, and maybe you're doing something during the day that's making it worse if it isn't getting better. Okay, then we look for the causes, obviously, of the pain, okay? Or the anything that's sort of flared you up, okay? Why has this happened? As Tope has mentioned, there's a number of factors that we take into consideration. Other things would be things like a sudden increase in load, whether that's running, jumping, increase in lifting weights, or something where you're doing explosive type of exercises. So yeah, like I say, we put a whole puzzle together and we work out what's going on. Okay, incorrect footwear, like Tope said. And on that, a nice tip on footwear is having something nice and supportive. So I've seen a lot of people commenting saying they know that if they wear the wrong shoes, that's a problem, or that they have the right shoes now, and it helps a lot. Okay, so shoes with a little bit of arch support on the back strap, certain pairs of Birkenstocks, Skechers, and I'm not naming specific brands on purpose. It's just that people have said that they've had great experience with them. So Birkenstocks, Skechers, some fit flops, not too high, but a nice cushioned heel, like a slight raise. And what was the other one? Birkenstocks, Skechers. Oh, and Crocs. Don't laugh, but apparently, if you are quite sensitive, they are, I know, right? They help to cushion quite nicely. So that's a nice one to use as well. Unfortunately, it is a condition that takes a while to get better. Okay, 90% of people will improve with conservative management. So there is that, although the research shows that it sometimes does take up to 12 months for you to have a full recovery. Okay. In the treatment, okay, so physio or what other sports physician, whatever medical direction you decide to go in, if you do go for an assessment, we need to sort of go down that checklist of risk factors that Tope mentioned, and we need to kind of identify each one and see where we can change that. So, for example, if it is an increase in load or something like that, we might need to dial back on that, or a specific exercise, maybe we need to change that. Okay. Yeah, so having said that, ticking all those boxes, what we would look at as well is not just the fact that the person has a plantar fasciitis, for example. We would look at other things along their chain. So like hips, knees, ankles, all that kind of thing, and correct. We can't just correct something and strengthen something that's happening at the feet without looking at the rest of the kinetic chain. Okay. So for me, there's always a chicken or the egg. Do you work feet up or hip down? It really depends on the specific case. Okay. So yeah, so having said that, you would modify activity. Okay. Then a nice one, even though it isn't an inflammatory condition that we've shown there, making a or getting a 2-liter Coke bottle. No, none of you should be drinking Coke, but get one from a friend. 2-liter water bottle. There we go. There's a good one. Put some water in it. Put in your freezer. And then when you're sitting down in the evening, even if it's while you're having dinner, rolling your foot, let's see here, sanitizer, appropriate. So you can put your foot over it and just roll your foot out, just gently over it. So you'll be rolling it as you go. So you're icing and you're slightly stretching at the same time. People find quite a relief in that. probably nothing to do with the actual inflammation, just a bit of relief with all the pain sort of cells in that area. Okay. Then there's been a lot of research on what is the optimal treatment. Okay, so I know I've mentioned a couple of things that you can try. There isn't one thing that works for people. It's basically a trial and error. So you can tick all the boxes, but I've also noted in the comments, some people say high heels work for them. Other people have said that it kills their feet. So you really need to give it a try and see whether a wedge, maybe not a high heel, but more of a wedge works for you to offload your feet, or something slightly lower. But flip-flops are terrible. We often have a boom of plantar fasciitis as well, going from winter into summer, where people are coming out of nice cushioned winter boots and with a slight heel into either barefoot or flip-flops, where you're kind of gripping on with your toes the whole time. Okay. So the research on the strengthening and the stretching, okay, they've done a lot of stuff on stretching the calf and Achilles. Well, not that you're stretching the Achilles, but stretching calf, Achilles, hamstring, or stretching just the plantar fascia, or stretching both, and then comparing it to a strengthening program. They found that everyone did eventually recover, the different groups of people doing those things, but the people that did quite heavy load strengthening, and obviously this needs to be guided, you can't just kind of wing it, a heavy load strength program, the patients who did that program strengthened and improved faster than the others doing just the stretching, which kind of makes sense, I think. And then what else? Oh, things to relieve your pain as well. Inserts in your shoes, doesn't have to be anything fancy. Obviously, like Tope was saying, with the arch and that, it's just slight support underneath the arch of your foot so that your plantar fascia isn't constantly kind of absorbing and expending that electricity energy like a spring. Okay, so think of your Achilles and your plantar fascia like a spring. You never want the spring to sort of get the energy and then recoil again. Okay, especially if you have an acute pain. Okay, so inserts in your shoes can be something super simple. If you want to see someone to have it done properly, that's also an option. And then gel heel cups from Sportsman's or wherever you want to get them, those you can have a lot of relief from those. Again, it's trial and error. Okay. Then other things that the sports physicians and some physios do is shockwave therapy. So basically, it's not an electric shock. It's a mechanical, sort of it's almost like a little mini hammer that's sounds funny, but kind of like hammers, like little shocks of energy, not energy, but like pressure into the area. Okay, it can be quite painful when they're doing it, but that just helps to stimulate sort of collagen production and blood flow to the area, and helps to heal faster, because generally tendons and fascia don't have a great blood supply. So we need something there to kind of stimulate that, to get it going again. Okay, so we're just kind of nudging it to heal faster. And then platelet-rich plasma injections that some of the sports physicians are doing. Also a lot of research happening on that. Again, mixed results with what's coming out in terms of what's successful and not successful. But basically what they do is that they draw your own blood and then they spin it, and then they re-inject the plasma with platelets back into the area, and that also helps to stimulate sort of regrowth and blood and fresh blood supply and stuff there to the area to speed up healing. So yeah, you kind of need to try a few things. I would try the simplest things first, like appropriate footwear, changing up your load, trying to identify what's causing the problem. And then funny tips and tricks as well. I think sometimes things we don't think about is untucking your bed sheets at the bottom of your bed. So I know, especially in winter, we want to be all nice and snuggly, and it's generally not like a winter condition. But if you think about how your feet will be pulled down in your bed, and then you get out of bed, it's really unhelpful with plantar fascia, because it'll be in the shortened position, and then you're making it stretch straight away. And then on that as well, just before you get out of bed, some really good, nice foot movements, like curling your toes and stretching your feet out, so that you're almost doing a little warm up before you even walk. Okay. Then you need to find those shoes that we were talking about. Okay, those are going to be your slippers. So I know how many of us wake up in the morning, jump out of bed, go to the loo, go to the kitchen, doing whatever you want, barefoot. No, Okay, we are going to get a nice pair of comfortable shoes, even if it's your running shoes, and we're going to wear those as our slippers until everything sort of settles down. Okay, and we've spoken about the ice rolling in the bottle. Yeah, and try not to, especially with HIIT and those kind of exercises, unless you have conditioned yourself to train barefoot, try not to train on a hard floor. And even so, if you have a gym mat or a nice carpet that you can do those type of exercises on, that's probably better than going straight onto a hard floor. And then also correct form with jumping. Okay, nice soft knees. I just want you to have a look when we finish here, get up and try a couple of jumps, land on the front of your toes, and then almost land on like the ball of your foot. And you can, what Tope has explained about when your toes are out, that's stretching like that, how much further the plantar fascia will have to stretch if you're landing up on your toes as opposed to more on the ball of your feet. Okay, so play around with that. And then early identification is probably the best thing. So if you feel like your feet are not feeling great, catch it as soon as possible. Either message one of us, see what you can do, or go and see someone for that. A physio, a sports physician, I'm trying to think who else. A GP you can see. Yeah, but I guess we would be super happy to help you. Yeah, and then going on what I said earlier, it's not always going to be plantar fasciitis. So one of the good sayings that we used to use somewhere that I worked previously was, if you're not assessing, you're guessing. So we can't just pass it off as plantar fascia, but hopefully some of the things that we've discussed now will help you either identify or self-manage at home, or at least guide you to where you want to be to get it sorted. Yeah. Anything else?
I mean,
okay?
I think also just managing your training and thinking about your training about in terms of the long run. I think a lot of us look at training and we assess it from what are we doing now and how fit am I now and how fit am I tomorrow? What am I doing tomorrow? But you have to be able to look at training and understand that when we talk about it as a lifestyle, it's something that you're doing for a long duration of time. So there's no real point in training yourself into the floor or into the ground now and then not being able to perform in a year's time. So finding ways to manage your training as well, and I'm sure you will realize that you can speak to your coach about a lot of these things as well, is that, for instance, you have people who do, say, for 6-7 months, almost every day doing HIIT exercises. You're putting a lot of impact, a lot of strain on your joints, on your fascia, a whole lot of that stuff. And so it's good to always find ways to, find that balance. If you're going for runs every single day, there's times when you need to allow yourself, take a bit of a break, allow your joints heal and recover. It's important to make sure that you're using the right type of shoes. I think it's always great to get, a professional to recommend some shoes to you, because we have other factors such as, protonation, supination as well, that can influence these two. So it's very important to make sure that you are finding that balance. You can always discuss that with your coach, and you can manage it. There's workouts and exercises you can do whilst you have plantar fasciitis that wouldn't cause the same amount of strain on your fascia. When we talk about things like the low impact exercises, a lot of those would not strain you as much. So it doesn't mean you absolutely have to completely stop doing anything. It just means you need to find a way to manage it. You need to speak to someone who's, well versed in that field and who can help you in terms of managing it. And you need to be able to know when to draw back and allow yourself recover, because that's very important too.
And that's also why it's so super important to use the rest days if you're on the one-on-one program, to use the rest days when they're recommended. Yes. And if you're dying to do something on that day, do something that isn't going to have heavy impact on your feet or your legs. Go for a swim, do some flow, something like that. You're still moving and you're still getting benefits, but you are letting all your joints that take all the impact some time to recover. And that's why we have the rest days there. But yes, you are fit enough, you can do it. But sometimes, another saying that I like, just because we can do it doesn't mean that we should.
Doesn't mean you have to, yeah. Most definitely. The rest is absolutely important. It's important for the level of performance that you have. It's important to get those body parts, recovered. That way you are still able to, perform for a long run. You need to allow your muscles rest. You need to allow your joints rest. You need to allow your connective tissue rest as well. I think there was a question about wearing heels as well, and why you may be prone to developing it with heels, and that really just comes down to the pointy way that heels are designed. Just because all of a sudden you have all of that pressure going in through one singular point, and that, as you know, when you put a lot of pressure, if you say pushed your entire arm into your hand or your entire palm into your hand, it wouldn't feel like much. But if you pushed two fingers into your arm, it feels a lot more pressurized. So it's just that pressure going through a point that's causing the heels to trigger these as well. But yeah, do we have any other questions? Anything that you guys would like us to answer?
Let's have a look here. Also, another thing is remembering people that sort of have like a desk job as well, sitting the whole day. It's a rush. You're finishing work, you're throwing on your running shoes or training shoes, and off you go. So a good warm-up also helps you there, and just being aware of that. Let's check.
I see a question here from Sharon about heel burn. Yeah, heel burn, like that burning sensation in the heels can really come from a lot of things. You can feel it if you have plantar fasciitis, but it doesn't necessarily always have to be down to that. Sometimes it could be down to nerve damage as well in the area, and that's why it's always important, if you can't place it, you get it checked out. You get it checked out by a professional, because then they're able to determine exactly where it's coming from. If you notice that it's not getting better after you've rested it, then it becomes important to have it checked out as well.
There's also a fat pad there as well in the heel, but often that can get inflamed if you've jumped and landed quite hard there. It's not as, in my mind, it's not as common as a plantar fasciitis, but there are other things in that area, like Tope says. There's a whole host of things that it could be. Yes. So typically, plantar fasciitis would be more sort of if you feel with your thumb on that sort of calcaneus, on that heel bone, at the front of it being more midfoot, and on the inside where it sort of starts, and then along the arch. That's normally where it is. But yeah, it could be. So it's almost impossible to tell with us sitting here.
I see another question from Miney about the tests at Spotman's warehouse. Yes, I think those are good basic place to start from. It's a nice basic baseline to work from. It's better than having nothing. Of course, the gold standard is going to a podiatrist and having them actually test out your feet. But those tests at your sports shops and the rest can give you a good overview as to the general anatomy of your feet, and just in terms of its structural say weaknesses and strengths as well. So yes, you can definitely use those too. Thank you, Veronica.
Oh, okay, yeah. I think it's basically, she's talking about another brand of running shoe, the Hoka's. Yeah, it really depends sort of what works for you. And there was a boom at one stage as well when everyone went to sort of neutral running, well, not neutral running, but the zero drop flat natural, and loads and loads of people got plantar fasciitis there. And then another brand brought out a shoe that dropped down slowly, so you phased into it, but that meant that you had to buy a different shoe every month. So whereas it sorted out the plantar fasciitis thing, or the Achilles tendonitis that were happening, price-wise, it doesn't really work.
Yes, definitely. Yeah, I see Amelia there said she's had shock therapy. It does work for some people. It's not going to work for every single person. And that's why you need to know the diverse ways of kind of managing it. The cold water bottle rolling can help out. With other people's shock therapy, or shock wave therapy will help. But other people just rest. It really depends on the type of or the etiology of the condition that you have in that time.
Yeah, New Balance broader. Yeah.
Yes. Yes, that definitely helps as well. It just helps to dissipate that force that's coming back into your feet. So I think just, in terms of the take-home message, you just need to be able to manage and think about your feet and the health of your feet, and understand that you have to bring into perspective the amount of force that's going into it on a daily basis. If you're jogging on the beach, you're less likely to be having that amount of force going into your feet. But if you're jogging on top, there's going to be a lot more going in. So if you've trained for a marathon, there's a huge chance that after that marathon, your feet have gone through a lot of strain. You need to allow them rest. You need to allow them recover. I see Rachel there's talked about plantar fasciitis actually, showing up as Achilles tendonitis. I think Kelly can talk about that as well.
Yeah, so obviously the Achilles tendon does go down the back of your heel and inserts around the calcaneus at the bottom. So they can kind of go together sometimes. Like Tope mentioned earlier, that if your calves and Achilles are super tight, it actually can also pull on the plantar fascia. So yeah, the one sort of can mask the other one. But yeah, both conditions actually do take some time to get better because they are made of similar sort of structure tissue. But yeah, Rach, glad you're better. Rach is one of my clients as well, so happy there. Nikki, you're asking what the Hoka is a good running shoe. You know what? Again, regardless of plantar fasciitis, I think we can recommend any running shoe. So you can say, oh, Asics is a great brand, Adidas is a great brand, blah, blah, blah. But I think the most important thing about a running shoe is that it's got to feel good from the moment you put it on. None of this wearing it in. So find a running shop where you can put the shoe on and they let you go for a little run around the block. I know there's a couple of places in Cape Town, and it's got to feel good. Okay, so it's got to feel nice and supportive. And then always remember that it's often helpful to take your old running shoes with you so that if they're experienced people in the shop, they can look at the wear on your shoe and see how you land. They can watch you run, and then they can recommend a shoe. So rather than them saying to you, this is a great brand, ask them for 4 or 5 different shoes that are similar, maybe even different brands, and then try those out and see how you feel. Guaranteed one of them or 2 of them is going to feel better than the others. So take brand out of it, go for comfort, close your eyes, put them on, see what feels best, to be honest. And just another thing is to check the drop. So like I said, take your old running shoes, check what the heel to toe drop is, and make sure that you're not changing that too much. And if you are, ask them how to sort of phase it in and not go flat out again in your brand new shoes. Okay, if there's a change there. Hope that helps, Nikki. Otherwise, send me a message. We can chat some more.
Yeah, most definitely, guys. You can just reach out to us if you have any more questions. We'll be happy to take them. Obviously, go ahead and ensure that you incorporate in your stretches as well. We have the challenge that's going on now with the Flow 21-day challenge. I think definitely, guys, that will help out a whole lot when it comes to ensuring that your calves are not as tight. But yes, guys, we'll be very happy to answer any questions that you have. Go ahead and pop them in the comments or send us direct messages. And thank you guys so much for listening to us today.
Thanks, guys.
Thank you, guys.